Paulina Agadou is on a mission that seems impossible. A single infection can spread like wildfire through crowded housing. Her job is to hand-deliver trusted information.
What's this for?
Yeah, it's for COVID-19.
Okay.
If you want to have a test done.
Agadou reaches out to people in a neighborhood hit hard by this virus. She meets personal support workers, Uber drivers, and clerks struggling to make ends meet.
A lot of people need help.
Hi, Judith. Yeah, go ahead.
Agadou's a volunteer with the Black Creek Community Health Centre. While many have never heard of community health centres or CHCs, they've stepped up to help slow the spread of this virus, often in areas that had high case rates but few resources. Cheryl Prescott runs the Black Creek Centre.
Our services are a bit underestimated. We feel invisible that, compared to larger hospitals or larger healthcare institutions.
Can I get two?
Unlike hospitals, they feed and connect with people on the margins. CHCs exist in every province, offering one-stop medical and social services. And they've been pushing for accessible testing and soon vaccinations as well.
Throughout this past year, I believe that we saw our value.
Still, provincial funding for community health centres isn't stable, and doctors say the problems are clear.
There's actually systemic discrimination in the way we pay for primary care. If you put the map of where primary care funding was and the map of where COVID was, there's a complete mismatch. Experts
insist community health centres need funding like never before. At an average minimum wage, full-time workers in Canada are now making less than $25,000 a year before taxes, and most have no sick days. Reports show the pandemic is only widening the income gap.
Who lives and who dies? And this is how stark the pandemic has been in exposing our public policy failures.
She was crying. I said, "Why are you crying?"
Agadou says she was able to help a woman who was about to lose her job unless she had a COVID test. She knows if the virus is anywhere, it's everywhere. She's not paid to do it, and yet she sees it as her job to try to protect everyone. Christine Burak, CBC News, Toronto.